Bizarre gets more unusual as COVID-19 presently seems to attack more than the respiratory and stomach-related frameworks. Early examinations of COVID-19 patients in January recounted the most well-known side effects: fever, hack, and trouble relaxing. More analyzed cases and research uncovered less regular manifestations, for example, spewing and looseness of the bowels, demonstrating that in certain individuals, the coronavirus was disturbing the stomach-related framework, not simply the respiratory tract. By late February, we learned of secretive cases including no indications by any stretch of the imagination, quiet super spreaders of a fatal malady who didn't realize they had it and felt nothing. At that point, a month ago, things got more interesting, as reports developed of analyzed COVID-19 cases in individuals who had lost their feeling of smell yet demonstrated not many or no different side effects of the infection. En route, doctors announced a few people with COVID-19 encountering gentle cold or influenza-like side effects, going from sneezes to exhaustion. But then it's despite everything getting more peculiar. SARS-CoV-2, the coronavirus that causes COVID-19, seems, by all accounts, to be assaulting individuals' minds. It's not yet clear how SARS-CoV-2 may be influencing the mind, yet involvement in different infections, including this season's flu virus, recommends it absolutely could advance there. Proof up until this point, nonetheless, includes just stories from doctors recounting COVID-19 patients at first encountering disarray, cerebral pains, and different side effects that might be brought about by irritation of the cerebrum, alongside early investigations including little quantities of patients, some of the time only one. In the meantime, it's not satisfactory whether or to what degree the coronavirus assaults the cerebrum legitimately versus COVID-19's respiratory impacts ransacking the mind of oxygen. It is exceptionally hard to isolate the two, says Chetan Rao, MD, a rehearsing doctor and partner teacher of nervous system science and neurosurgery at Baylor College of Medicine Medical Center. Rao suspects the two components are busy working. What's more, things can break down rapidly. He has seen in any case solid COVID-19 patients go from talking regularly while accepting a modest quantity of oxygen to being put on initial a ventilator and afterward a progressively genuine heart-lung emotionally supportive network, all in about 4 hours. He has seen in any case sound COVID-19 patients go from talking ordinarily while getting a modest quantity of oxygen to being put on initial a ventilator and afterward an increasingly genuine heart-lung emotionally supportive network, all over the course of about 4 hours. Various cases detailed. The likelihood that COVID-19 is attacking the mind straightforwardly rose back in February in an investigation out of Wuhan, China, the focal point of the underlying episode. At that point, in March, scientists brought the chance up in the Journal of Medical Virology, expressing that this coronavirus, SARS-CoV-2, is like others that are not constantly limited to the respiratory tract and may likewise attack the focal sensory system, instigating neurological illnesses. As of late, a lady in her late 50s who had encountered 3 days of hack, fever, and changed mental status was tried for influenza, which she didn't have. Turns out she had COVID-19. Mind checks indicated strange growing, and doctors analyzed it as intense necrotizing hemorrhagic encephalopathy, which is an uncommon focal sensory system confusion auxiliary to flu or other viral contaminations, which is portrayed by modified mental status and seizures, and frequently this further prompts significant incapacity or demise. Different tests were done on the lady to wipe out some different infections that may cause the analyzed condition. Flu is known to cause, at times, encephalitis and its neurological outcomes, for example, strokes and seizures, Rao says. This is the main detailed instance of COVID-19-related intense necrotizing hemorrhagic encephalopathy, the doctors, from the Henry Ford Health System in Detroit, finished up on March 31 in the Diary Radiology. As the quantity of patients with COVID-19 expands around the world, clinicians and radiologists ought to look for this introduction among patients giving COVID-19 and modified mental status. For another situation, a 74-year elderly person with previous neurological conditions had out of nowhere lost his capacity to talk. He was at last determined to have COVID-19. Since COVID-19 influences the old more and those with previous conditions, patients with earlier neurological conditions and intense respiratory side effects are at an expanded danger of encephalopathy on starting introduction, his doctors composed. Getting into the cerebrum. It's not yet clear how SARS-CoV-2 may be influencing the cerebrum, however involvement in different infections, including this season's cold virus, proposes it unquestionably could advance there, Rao and others state. SARS-CoV-2 is fairly slippery, another examination in the diary Nature proposes. The infection enters human cells through a specific kind of cell receptor. It appears to regularly hold at first in the upper respiratory framework, primarily in the throat, without ordinarily causing numerous side effects there. At that point, in cases bound to turn out to be progressively extreme, the infection moves into the lungs as well as the stomach. The cells with the correct receptors for SARS-CoV-2 are found broadly in the lungs, Rao tells Elemental, clarifying why breathing issues are regular in extreme COVID-19 cases. Be that as it may, those receptors are likewise found in veins in the blood-mind boundary and in nerve endings, he clarifies. It is unquestionably conceivable that the sensory system is being attacked through these methods, Rao says. Until increasingly authoritative research should be possible, COVID-19's baffling ways are an ever-moving objective, says Peter Gulick, an oncologist and irresistible sickness expert at Michigan State University's College of Osteopathic Medicine. Furthermore, he's not prepared to acknowledge the contextual analyses as confirmation of what may be going on. Intense encephalitis is certifiably not a known introduction of COVID-19, despite the fact that it has given different coronaviruses, Gulick says by email. In any case, we should keep on following cases to check whether any neurological conditions do happen because of COVID-19.